Today we are going to discuss about identification. So, what is the overview about this presentation is like identification, definition, and introduction. What is meant by corpus delicti? Data used for identification with respect to race, religion, and sex. So, coming to the definition of identification, it's very important. Identification is the determination of individuality of a person, living or dead. It means like exact fixation of the personality. Like we are establishing the identity of a person based on certain data. Uh, the process of which is called identification. The evidence of personality can be of these three forms. One is like token based, one is knowledge based, and one is biometric identification. Token based is all the documents which are used to prove our identity. Like we are using it on everyday basis. Like even if we want to go and open a bank account, and if you want to get admitted in college or school, anything like anywhere, if you want to apply for some passport or some other ID cards, like we have to submit certain documents. For example, like Aadhaar card, PAN card, driving license, voter's ID, ration card, all that can be used as a document to prove our identity. Even like birth certificate is mandatory for applying Aadhaar card. So all these the documents which are used is based on token based. So coming to the knowledge based information only individual would know. That is like in certain, even in certain applications and all that, they will ask a few questions or three questions which we have to answer that we would only know. So that if you want to log in again or open it, like we can answer the same thing. It will be like used as a data to secure security also. So the information that only the person would know can be also used to establish the identity that we call as knowledge-based evidence. And third most is like the biometric identification. Biometry is like anything that proves that the person is of such so and so identity. Like for example, we all have this fingerprint and face-based authentication for our NMC attendance, and wherever like in most of the places biometry plays a major role. Like even in Aadhaar, biometry is like plays a role. So this is biometric identification. And we have to know why it is done, why identification has to be done. So I have classified this into four things like living persons, for dead persons, for criminal investigation, and for humanitarian cases. I'll just cover up the humanitarian cases first. Like if the person is dead and if we can able to establish the identity, it will give some relief to the anxious family who's waiting this person belongs to my family for the current identification of the dead much prompt notification of the anxious family. And one more thing, the dead person has a right to be, disposed of or like have a relation with all the ceremonies of their own religion. Even the dead person has their right uh, cremated with so much respect and love for that. So on for these basic humanitarian grounds, identification has to be established. Coming to the proper thing, like before it, for living persons, in case of marriage and remarrying the surviving spouse, for this we have to submit some reports that will prove our identity. And for a missing person, for applying the passport, for settling the estate, worksman compensation, for inheriting the property in case of disputed sex, all that we have to prove our identity by all this identification based thing. So coming to the dead person, like in accidents and disasters, one has to be identified. And in case of war crimes and genocides, in recent past, like even now we have this India Pakistan this, small minor clash in which few people are dead. The identity was established by one of these following data. And recently in Kerala also there was a massive landslide. Like many of the people have died. In that also their identity is established. And to settle to claim the death benefits and to collect the life insurance and to providing a will. and for establishing the identification in case of mutilated, skeletonized, and disarticulated bodies, or in badly burnt bodies where we cannot able to identify the person, and in decomposed bodies. In all these patients, all these dead persons, we have to establish the identity with the data that has been used. So for criminal investigation, like in case of unexplained natural death, homicide, or suicides, and for an impersonation or identity theft, like impersonation of identity theft is like the person lives in the identity of the other person or changes the identity. In such cases, identification has to be done. And in case of interchange of babies at hospital, it is also very common, like they'll just steal the baby. It's a criminal offense also. In such cases, identification has to be done. And for a person who are accused of rape, murder, dacoity, and assault cases, identification has to be done. And to establish a corpus delicti, and in case of criminal abortion, and in case of criminal abortion leading to death of the lady, in that also identification has to be done. And especially for absconding soldiers, identification has to be done. So coming to corpus delicti, what is the corpus delicti is like it's a Latin word. It means corpus means crime, delicti means body. So it literally means body of the crime. It is also known as foundation of the crime or essence of the crime. It literally means anything that proves the crime positively, which means that there should be a presence of evidence than the absence of thing to prove that crime has occurred. It is a legal principle requiring the positive proof of crime before someone can be convicted of committing that crime. So corpus delicti is very much important before we confirm that someone has committed the crime. Like for example, in case of homicide cases, it can be the dead body, it can be the photograph of the dead body, or it can be the blood stain, the cloths, weapons, weapon marks, bullet, or any severed body parts and head. This is the example showing the corpus delicti, like that's a dead body here, or the knife with the blood stain, the marks, like and the bullet. So coming to the data which can be used for identification, uh, race, religion, sex, age, stature, complexion, features, physical features, hair, deformities, moles, birthmarks, scars, tattoos, anthropometry, that is body measurements, dactylography, that is fingerprint, footprint, paleoprint, print, superimposition and reconstruction of face, clothes and personal article, molecular finding like DNA fingerprinting, frontal sinus pattern, iris and retina scan, nails, skull suture pattern, vascular grooves, X-rays, handwriting, mental power, memory and education, speech and voice, manners and habits, of which major four is race, sex, age, and stature. The major four, based on that identification is made out, and uh, currently we are using sex, age, moles, birthmarks, scars, and tattoos as identification marks in case of any report writing, example, in case of injury report, all that. Dactylography, that is fingerprint, and molecular profiling, like DNA fingerprinting. In identical twins, even the DNA can be of both can show same DNA, but fingerprint it is very specific to each individual. So coming to race, it is a biological grouping within the human population classified according to the genetically transmitted differences. So this is the definition of race. Race can be established also by clothing, complexion, eyes, hair, skull, and indexes of long bone. So there are three recognized races like Caucasoids, Mongoloids, and Negroids, which this has been recognized based on these categorization. That is skin, eye, nose, hair, soft tissues, and skeletal features like head form, Cranial features, face form, stature, and dentition. So this is the table showing the difference of features between the Caucasians, Mongols, and Negroes. So coming to the Caucasian, the skull is rounded, the forehead is raised, the face will, here they'll have orthognathism, that is the, if we measure the tip of the root of here, tip of the nose and tip of the chin like this, it should become straight line. It is called orthognathism. Uh, and orbits will be triangular. Nasal opening is narrow and elongated. Palate, base of the palate will be looking triangular. Nasal index is less than zero point 0.4. What is this? Mongol's skull is square shaped. Forehead is inclined and flat is face is flattened and large. The molar bones are prominent in this, and the nasal opening is rounded. Palate will be of horseshoe shape. Base of the palate will be looking horseshoe shaped. Nasal index is between 0.4 to 0.5. In Negroes, it will look like narrow and elongated skull, and the forehead will be small and compressed. They will show prognathism, that is, jaw will be projecting. The lower jaw will be projecting front, and they have prominent malar bones. Orbits will be of square shaped. Nasal opening is broad, and palate will be looking rectangular. Nasal index is more than 0.5. So this is a negroid skull I was talking about. That is elongated forehead, square shaped orbits, nasal aperture, all that. Hard palate will be long. So this is Mongoloid skull. It shows the prominent malar bones, and they will have this triangular palate. So this is a lateral view showing the Caucasoid and Negroid skull. Here there is flattening of temporal bone. Here the temporal bone is prominent, and it is showing a prognathism, that is the lower jaw is projecting. There is orthognathism, that is the both jaws are in the same height. So what about our race? Indians are highly intermixture of races, especially Caucasoids and Negroids. Usually Caucasoids are Europeans, Mongoloids are Chinese and Mongols, Negroids are Africans. So coming to certain indexes which can be used to establish the race. Cephalic index is maximum breadth of the skull by maximum length of the skull in 200. Here we will see in detail. That is, maximum breadth is between two parental prominence, and maximum length of the skull is from the glabella to the posterior occipital protuberance. Uh, so we measure this with the osteometric probe or the Vernier caliber, all that, and then into 100. So based on the index, with the skull type is divided into dolichocephalic, that is long. The cephalic index value is between 70 to 74.9. Usually the negroids will have this, and cephalic index will be 75 to 79. Pacific cephalic, that's medium shape. Caucasoids have this medium shaped skull. Cephalic index between 80 to 84.9 is brachycephalic, short skull, seen in Mongoloids. And there is one type called hyperbrachycephalic, that is, it is between 85 to 89.9. It is like the lab broadhead. To see in certain people, Kyushu of Japan and Hubbard syndrome. So this shows the age where the suture fusion would occur, like sagittal suture, they have divided the sagittal sutures itself, and the suture closure formation will start at this age and it will be complete by this age. So based on this suture closure, if there is premature fusion of these sutures, they can have different in shape of skull. Like if the sagittal suture is closed prematurely, the skull can be like dolichocephaly, that is the narrow and elongated or scampecally. And if the coronal suture is sutured prematurely, there will be brachycephaly or anterolegiocephaly. And if the metopic suture is closed prematurely, they can be having a trigonal head. And if the lamproid suture is fused prematurely, they will be having posterior plagiocephaly. This is a normal cephaly. That is, all the sutures will be fusing at the appropriate age. Coming to brachial index, it is the length of radius by length of humerus. So into 100. So length of radius is between the head of the radius to the styloid process of the radius. It is measured between this. And length of humerus is most proximal point of head of the humerus to the most distal point of the trochlea. Here is the trochlea. The most distal point will be here, from here to the most proximal point. So this is the length of the humerus. Written index. We have average values for caucasoids and negroes. So coming to the oral index, so it is the length of the tibia by length of femur into 100. The value average Europeans will have 83.3. Average Negroes they have 86.2. The length of the tibia is between the superior part of medial condyle to the tip of the medial malleolus. The length of the femur is between the highest point of femoral head to the lowest point of medial condyle or the epicondyle. So here, from the highest point of the head to the lowest point of the condyle, from the superior part of the condyle to the tip of the malleolus. Coming to the intermembranous axis, length of humerus plus length of radius by length of femur plus length of tibia into 100. Humerofemoral index is length of humerus by length of femur into 100. Length of humerus and length of femur. We are comparing the parental. Average, average value for Europeans is 69. Average value among Negroes is 72. So we can establish the race from the teeth also. Usually this whites or the Caucasians will have scarabelly cusp. That is, it is also known as the accessory cusp seen in the molars. One more cusp, that is scarabelly cusp. And Mongoloids will have three features. That is, they have shovel-shaped incisor, bull's teeth. That is taurodontism, and enamel pier. That is whitish pear-like structure seen on the teeth. And certain features will be characteristic of certain religion, like the Hindu males are non-circumcised and wear sacred thread. Muslim males are circumcised and they can have corns and callosities over the lateral aspect of knees and feet, and they will have the black spot over the forehead. This is known as prayer callus. And Hindu females wear sindoor on head, earrings, and nose rings. So these are corroborative evidence just to identify the religion of the person. And coming to the sex, so I'll just discuss about the definition alone. So sex means the biological term denoting the genetic, physiologic, and anatomical characteristics of an individual based on which we can identify ourselves into male and female. It is a biological term which will see the genetic, physiological, and anatomical characteristics. Coming to the gender, it is like a sociological construct, how individual sees themselves or how the person identifies themselves according to the social norms. Like it will be based on the social roles, social and behavior, based on which it will exhibit masculine or feminine qualities. So gender is a sociological construct. It is the sexual identity of an individual from birth to puberty and adulthood. Intersex is intermingling of sexual characters of either sex in one individual to a varying degree, including physical form, reproductive organs, and sexual behavior. Like in one individual itself, they can exhibit the characteristics of both. In what conditions sex determination is done is it is one of the important aspects of identification and to establish the individuality of the person and to participate in sports and to decide whether they can exercise certain civil rights, like especially to the females, and for deciding questions relating to the legitimacy, divorce, paternity, marriage, impotence, rape, and affiliation. So identification becomes difficult in certain conditions like intersex, which is natural and acquired. If they are castrated before puberty, they are majoras, and if they are castrated after puberty, they are called xenonas. Transvestism is wearing clothes of opposite gender. Transgender is the state of one's gender identity or gender expression not matching with one assigned sex. That is gender dysphoria. Biologically, they can have one sex, but they'll identify themselves as different sex. This is known as gender dysphoria. Transsexuals is like those who have undergone sex change or sex reassignment surgeries, like from male to female and female to male. And in the concealed sexes, individuals hide the real sex for a motive by cross-dressing. And in in advanced decomposition and skeletal remains, identification becomes difficult, but the English and prostate assess putrefaction, so from which we can establish the sex of the individual. So in most of the cases of living persons, the most certain evidence of sex is position of ovaries in females and testes in male. Highly probable evidence of sexes like position of sexual characters, that is developed breast and vagina in female and male distribution of hair and feelings in males. Presumptive evidence of sexes, outward appearance of individual features like contours of face, clothes, voice, and figures. So coming to the sex verification test, from external physical morphology, we can establish the sex. And there is something called nuclear sexing or sex chromatography. It's a microscopic test in which the buccal epithelial cells or the hair follicles used to stain, and in microscopy we can see the presence of bar body. Uh, I mean, we can do gonadal biopsies. Tests will show XY chromosome and O will show XX chromosome. And there are certain gene-based tests where there will be sex-determining region of Y chromosome. It will show SRY gene and DYZ region in Y chromosome. That is a very specific diagnostic of sex. And testosterone levels in the females will be less than 10 nanomole per liter. It is lower than the lower limit of male. So these are the difference of morphological features between male and female. Generally, male will be having stronger muscular stout build, the female will be having less muscular and delicate slender build. This hair will be short, thick, and coarse. Scalp hair will be long, fine, and thin. Facial hair present in male, absent in female. Pubic hair is thick, coarse. It is this is specific. They'll have a thick, coarse pubic hair which extends upward with apex and umbilicus, whereas in females it will be thin, fine, horizontal, and covers the mons pubis. So Adam's apple will be prominent and less prominent in case of females. The shoulders will be broader than hip, in female it is narrow than hip. Waist is defined, well-defined in females and not defined in male. Trunk with the abdominal segment will be smaller, whereas in female it's larger. Thighs will be cylindrical, thighs will be conical, breasts not developed, breast develops after puberty. Uterus and vagina is absent in male and present in female. Penis is present in male and absent in female. Gonads will be testes of male and ovaries in female. Coming to the nuclear sexing, it is a method of sexing cells which may help in determining sex in doubtful cases, decomposed and mutilated parts and fragmentary remains. Bar body is nothing but it is a condensed inactive X chromosome that is found. That is normally the females will have two X chromosomes. One of the X chromosome becomes inactive and it will become condensed. It will be demonstrated in most of the somatic cells. Here, this is the bar body. In certain conditions, like in Turner syndrome, there will be only one X, so there will be no bar body. And in case of triple X or Klinefelter syndrome, there will be two bar bodies because there will be the other two X chromosome will be inactivated and become two bar bodies. Davison body is something like It is a small nuclear attachment in the drumstick form. Is she seen in neutrophils? About 6% of female will show this Davidson body. Also, from teeth, we can able to determine the sex. Like in case of males, they'll have large mandibular canine males than females. This will be diagnosed with the help of optical scanner or radiographic measurements. So, and also from the dental pulp tissue, we can demonstrate the Y chromosome using unicrine and fluorescent microscopy. And also sex determination from the enamel protein, that is amylogenic, is the major protein seen in the human enamel. This will be different in male and female. So this is the a demonstration of Y chromosome in quinacrine dihydrochloride. That is, Y chromosome is seen like a fluorescent body in male cell. It is absent in female cell. And this is fluorescent fuel gel reaction using acrylamine Skiff reagent, in which X chromosome is seen as a red violet spot in the nuclei. X chromosome will be seen as a red violet spot in the nuclei. These both will be demonstrated under fluorescent microscopy. This also helps in determining the sex from the decomposed bodies. So, coming to the intersex, it is again like definition is intermingling of sexual characters of either sex in one individual to a varying degree, including physical, reproductive, and sexual behavior. Earlier, Davidson divided the intersex into gonadal agenesis, gonadal dysgenesis, true hermaphroditism, and pseudo hermaphroditism. Currently, this has been replaced into the term called DSD, that is disorders of sexual development. It's the basic general outline of disorders of sexual development, that is disorder of gonadal sex, where the chromosomal sex is normal, but the gonads will be abnormal. Like they'll have XX and XY chromosome, but still they have some problem with gonadal growth, gonadal agenesis or dysgenesis or allergic testis. Disorders of chromosomal sex, that is the chromosome number or structure will be abnormal. This can lead to disorder DSD, that is critical to symptom with more than 2x, and internal symptoms will be absent of 1x. And disorders of phenotypic sex, that is they can have normal gonads, normal chromosome, but they will have abnormal neurogenerative tract due to some other hormonal reasons, like for example, androgen insensitivity syndrome or congenital adrenal hyperplasia, where there will be this secreted androgens will not be converted into the active forms, or even if it is converted, it cannot be act on the subtask due to the insensitivity syndrome. So this can influence the development of secondary sexual characters and the development of urinary tract. So in this, they'll have normal gonads and normal chromosome, but they don't develop the proper urinary tract and sexual characters. This is a broad classification showing the of sexual development. Intersex is a huge topic and important for FMT PGs for exam purposes. So that can be dealt in detail in next presentation or the next video. So that's about the identification with respect to race, religion, and sex. So thank you, and we will meet again in another video where I'll be continuing the discussion of this identification. Thank you.